The eyelid is one of the most specialized structures in the human body. Despite its small size, it contains multiple tissue layers with distinct functions, a rich blood supply, complex nerve innervation, and numerous glands. Understanding eyelid anatomy is essential, because even small pathological changes can rapidly affect vision and comfort. The eyelid protects the cornea from trauma and drying. It spreads tears evenly across the ocular surface, ensuring proper lubrication. Tears are drained through the lacrimal system into the nasal cavity. Normal eyelid function maintains visual comfort and prevents irritation and infection. The eyelids also influence facial expression and cosmetic appearance. Importantly, many systemic diseases first present with visible eyelid changes. The eyelid skin is the thinnest skin in the entire body, measuring approximately 0.5 millimeters in thickness. It is highly elastic and mobile, contains a rich vascular plexus, and has dense sensory innervation. Because of its vascularity, the eyelid bleeds easily from minor trauma, but it also heals quickly. The skin is highly sensitive to irritants and allergens. With aging, elasticity decreases, leading to wrinkles and eyelid laxity. The orbicularis oculi muscle is the primary muscle responsible for eyelid closure. It is a circular sphincter muscle supplied by the facial nerve, cranial nerve 7. The orbital portion produces forceful closure, used during tight squinting and emotional facial expressions. The palpebral portion controls gentle blinking and normal eyelid movement during vision. The lacrimal portion, also called Horner's muscle, functions as a lacrimal pump, helping drain tears into the lacrimal drainage system. Damage to the facial nerve results in inability to close the eye, leading to corneal exposure and keratopathy. Muscle spasms can cause blepharospasm and significant functional vision problems. The levator palpebrae superioris is the primary muscle responsible for opening the upper eyelid. It originates from the annulus of Zinn and inserts into the superior tarsal plate. It is supplied by the oculomotor nerve, cranial 3. Muller's muscle is a smooth muscle that assists eyelid elevation. It receives sympathetic nerve supply and contributes approximately 2 millimeters of eyelid elevation. Loss of sympathetic function causes mild ptosis, commonly seen in Horner's syndrome. Severe levator dysfunction results in complete eyelid drooping. The tarsal plates form the structural framework of the eyelids. They consist of dense fibrocartilaginous connective tissue that provides rigidity and support. The upper tarsal plate measures approximately 11 millimeters in height, while the lower plate measures approximately 4 millimeters. The levator muscle attaches to the upper tarsal plate, making it essential for eyelid elevation. The lower tarsal plate is more mobile and less rigid. This anatomical difference explains eyelid malpositions such as entropion, inward turning of the eyelid ectropion, outward turning of the eyelid. Meibomian glands are modified sebaceous glands embedded within the tarsal plates. The upper eyelid contains approximately 25 to 40 glands, while the lower eyelid contains 20 to 30 glands. These glands secrete lipid-rich meibum, which forms the outer layer of the tear film. This lipid layer reduces tear evaporation, stabilizes the tear film, lubricates the ocular surface. Meibomian gland dysfunction leads to tear film instability, dry eye disease, blepharitis, and chalazion formation. The conjunctiva is a mucous membrane lining the inner surface of the eyelids and covering the eyeball. The palpebral conjunctiva lines the eyelids, while the bulbar conjunctiva covers the eye surface. Goblet cells within the conjunctiva secrete mucus, which contributes to tear film stability. The conjunctiva also provides immune defense and protects the ocular surface from infection. The eyelid is a complex, multi-layered structure designed to protect and maintain vision. Understanding each anatomical layer allows clinicians to accurately diagnose eyelid disorders and effectively manage ocular surface disease.